The other day we had a meeting with the healthcare system and they said, well, we have impeccable hand washing protocols. And I said, look, that's commendable. That's so key. We all know this, right? But the truth is, when you look at where a patient's privacy curtain is installed in a room, typically you walk in the room, you wash your hands, you touch the curtain, you look after your patients, you touch the curtain, and then there's the sink. So arguably, it really is that weak link, that super high risk touch point in a patient zone, as we like to call it, that people are overlooking, frankly.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now it's time to roll back and start the first case.
On this Vendor Spotlight, we are going to be speaking with Karen Goelst, CEO and founder of KleenEdge, and Melanie. Karen is an entrepreneur and bringing a very unique solution at least timely for our conversation. I know this has been in the works for quite a while, but we're going to have a conversation around sustainability, infection prevention. And when I say sustainability, it's cost savings, it's repeatability, it's operational improvements, and it's also friendly to the environment. And so I think what everybody will find, as you have learned, putting together her expert series on the First Case podcast channel, that this is a lot more in depth than you might think, and it has a much greater impact on patient safety than we might always be aware of. We take curtains quite for granted.
Yeah, we really do. We absolutely take them for granted. They're kind of like the chair in the room or just some extra furniture, and we don't think about it. And an eye-opening conversation is definitely needed when it comes to the exposure risk and contamination risk that curtains present. It's just something we don't think about. Also, I think you're right with the sustainability and the cost savings that they offer. These are topics that hospitals are interested in. People want to know, how can we help the environment? How can we have a sustainable solution? And this conversation with Karen is really going to give us that opportunity.
All right, don't go anywhere. We've got this podcast going out on several of our family of podcasts. Melanie is the co-host of the First Case podcast. But if you're listening on power supply or transmission control, this is really a broad, sweeping conversation. Stay with us. We're going to be right back with Karen Goelst.
A 17 Studios production, you're listening to First Case.
Joining us now is Karen Goelst, CEO and founder at KleenEdge. And Karen, you've been on the First Case podcast before, but this conversation today is going to go out to our power supply chain audience, as well as infection preventionists that listen to the Transmission Control podcast. For those of you who are listening and aren't familiar with Melanie Perry, she hosts the First Case podcast with me, and this is also going out on the First Case podcast. So what's interesting about our conversation, Karen, is it really touches so many areas within the hospital. We're going to be talking about it today quite in depth, and I just want to welcome you back to the First Case podcast, but for your first appearances on transmission control and power supply. Thanks so much for joining us.
Oh my God. Thanks, Justin and Melanie, for having me today. It's always fun to join and raise awareness, and thanks for having me.
We have had a number of conversations on the Power Supply podcast about sustainability, and it means a lot of different things in the context of healthcare since the beginning of the pandemic. I would say prior to that, most of the time when people heard the word sustainability, they associated it with what we're going to be talking about today in the sort of sense of impact on the environment and recyclable materials and processes, and thinking about the impact on the environment. But sustainability means a lot of different things now, including the ability to sustain whatever operation you've put into place. And that's all going to be part of this conversation. And it's going to be around privacy curtains, which, Melanie, obviously in the operating room, we talk a lot about. And then for the infection control folks out there, I mean, privacy curtains are in every patient room throughout the hospital. So, Karen, I want to welcome you to talk a little bit about what's going on at KleenEdge. I know it's a women-owned business, and women-owned by the fact that you're the CEO and founder. Maybe you could talk a little bit about how you find yourself leading this organization and doing the good work that you're doing today.
Oh my gosh. Thanks, Justin. Yeah, it's been quite a journey for us, as you guys are aware of. I mean, it's probably started, 10 years ago when, my background was in window coverings, come from the Netherlands, where we did a lot of healthcare, and frankly started, kind of going out into healthcare and saying, gosh, what are folks doing in America, as it pertains to privacy curtains? And one of the big eye openers for me coming from Europe was really that all the privacy curtains in America were mounted at the ceiling, and then they had mesh, and that is, by the way, not the standard of care elsewhere, where they use suspended tracks. So one of my very early questions was really to say, well, when it's mounted at the ceiling, I mean, how in the world do you exchange these curtains? And that really started the journey, because the answer was curtains, unfortunately, in America hardly ever got exchanged. And yeah, that's really started it all, to say, gosh, what can we do to change that? Can we create solutions that will help folks in their efforts to get these down more frequently? And also, as you both are aware, we created a software surrounding the exchange to allow folks to set protocols and then to know that they're in compliance, and start articulating the reasons, by the way, why they're exchanging curtains.
Well, infection control is a big reason why they're exchanging curtains, correct?
Why they should be exchanging curtains, yes. It's pretty horrific, when you read all the studies, and they're very, very clear now that basically within 2 to 3 weeks, most curtains installed in our country will be contaminated with MRSA, C. diff, VRE, and then, of course, the pandemic really has been an eye-opener for us all surrounding high-risk touch points. And guess what? Yeah, that curtain, guess what? Everybody touches the curtain, right? There's no escaping it.
Well, even prior to the pandemic, hospitals were faced with some pretty major changes in reimbursement. And so we've seen a lot of data coming out about healthcare-acquired infections. And prior to the Affordable Care Act, we didn't really worry as much about it. It wasn't like we didn't worry about it. We didn't worry about it in a business sense. Like, how is this going to impact our ability to be profitable? Obviously, that change in reimbursement, if somebody comes back in with a hospital-acquired infection within 30 days, unless it's an implant procedure in surgery, the hospital ends up having to foot the bill on that. And so we've looked at infection prevention through a completely different lens since then. And then obviously the pandemic just vaulted us into a new state, and financially hospitals have never been under tighter constraints, from staffing issues to just operating on negative margins, all of this. And, this is an area where if we can reduce readmissions due to infections, that could really help out the bottom line. And nowadays, every little bit counts.
Yeah, I couldn't agree more, Justin, and the bottom line, oh, by the way, speaks loud and clear. And that's why it's also important to understand the challenges, oh, by the way, that people have surrounding these curtains. Because if you need to put your staff on a tall ladder and you have a completely non-standardized inventory where folks need to be in the basement going, okay, where does this curtain go? Is it a 10-foot ceiling? Is it an 8-foot ceiling? How wide is the track? Right. So when you look at the burden, or what we would like to say, the downstream consequence of ceiling mounted tracks for hospitals really is that they're going to have to send a person up on a ladder, trying to figure out what size curtain, because how many times do you and I walk into a facility and we see that curtain hem almost 2 feet off the ground, right?
Right.
But think about it, going all the way in the basement, figuring it out, schlepping it up to a patient room, putting the ladder up, climbing up an 8-foot ladder, and sometimes standing there, as a staff member with a 40-pound curtain, grommet by grommet by grommet, having to hang it. So every time and motion study that we've ever done surrounding this, it takes people over an hour. And hello, we're in a staffing crisis, right? So if you think about the staffing crisis, the non-standardized cost of cloth curtains, especially the laundering. I mean, we talked a little bit about environmental, just the overall cost of that. It's really, really challenging for people to exchange them.
Well, we're going to talk about how that you can reduce the acquisition cost by 50 to 85%, and also operational cost reductions of anywhere from 35 to 55%. But honestly, something that you just talked about was tracking it and having a lot of variation in the types of curtains and knowing how many curtains are there, and that being tasked on environmental services typically. That is a daunting task. How would they even know when or where a curtain might be that needs to be, swapped out? And what are some of the regulations around that?
Yeah, gosh, and that opens up a whole different can of worms because, as you both know, most of the documentation in our country is still manual. So again, think about that EVS staff member, they've just gone on that ladder, and now they need to handwrite on the label when they exchanged it, document it on a spreadsheet, which pretty much always gets maintained in the EVS office in a 3-ring binder. So the system is very archaic. And if you're someone that has 3,000 curtains hanging, and oh, by the way, you're also doing the isolation room exchanges, potentially as many as 40 a day, by the way, which calls for the exchange of the curtain, how in the world are you going to remember when your upcoming exchanges and what, where, and when, by the way, you need to have sufficient inventory on hand? That was, by the way, another thing, of course, that we ourselves worked on for 5 years is really putting together a protocol compliance software that not only sends automated reminders, but that also allows folks to articulate the reason why they exchanged the curtain. Because arguably, think about it, if you cannot demonstrate in a terminal clean that you actually did follow your protocol, which requests a removal for MRSA or C. diff or VRE, I mean, gosh, that potentially is more crucial than ever, right?
Absolutely. Actually, you made me think. You were talking about, how often we have our curtains actually being exchanged. And I think PACU, I think pre-op, I think all these places where we have curtains in surgical services. And how many times do they just hang until they look gross? And then we finally trade them out whenever they finally look bad because we don't necessarily know when the last time it was exchanged. How often do you think really that's the default method of curtain exchange, is just when it's torn or when it just looks really bad?
Yeah, gosh, Melanie, the biggest challenge potentially that we still have in our country is that the standard of care is so poor. I mean, we basically have a regulation that says remove upon visibly soiled or stained. Well, I don't know about you guys, but how often do we walk into a patient room and there's a brown multi-patterned curtain hanging there? You know, how do we know, right? Oftentimes you cannot see that they're stained. But if you think about, look, we're not dealing with the visibly soiled or stained. I mean, that's kind of scary, right? When you see a big spot on the curtain. But what about what we talked about earlier, where we have studies that absolutely demonstrate that these curtains are contaminated with invisible bacteria after 2 to 3 weeks, right? And, you know, we've known each other for a long time, but, you know, in my personal life, I dealt with a scenario where my then 14-year-old son was hospitalized and had MRSA, and how impeccable that care is from EVS being in there, decontaminating all solid surfaces. But when I walked to that curtain in his room that everybody touched all day long, it had been in place for over 14 months. And frankly, without some kind of software that really monitors that, I mean, how do we keep those scenarios from existing, right? It's just not acceptable.
No, I agree. It's not. It isn't acceptable to think about it in those terms. And you think about your son, you know, suddenly when we think about our patients, not just as patients, but we think about them as our son or our daughter or our mom or our dad, our family members. We really care about all of those surfaces that are being touched. And every time we touch a curtain to pull it back or pull it back around our patients so that we can take care of them, our hands have gone from the curtain to them and we have risked exposure once again. So it's definitely something I don't think we think about as often as we should when it comes to what we're touching and then what we're passing on to our patients.
Yep. No, and it's such a good point, Melanie, because, you know, the other day we had a meeting with the healthcare system and they said, well, we have impeccable hand washing protocols. And I said, look, that's commendable. That's so key. We all know this, right? But the truth is, when you look at where a patient's privacy curtain is installed in a room, typically you walk in the room, you wash your hands, you touch the curtain, you look after your patients, you touch the curtain, and then there's the sink. So arguably, it really is that weak link, that super high risk touch point in a patient zone, as we like to call it, that people are overlooking, frankly.
So one of the things that you said was that the EVS workers are getting up on the ladders. And so I got to imagine like carrying a ladder around, like how much added time is that? And when you tout that there's 35 to 55% operational cost reduction, I'm assuming that that's one of the major areas is that just extends out the labor piece. I also got to think that it puts staff at risk for potential injury too. Like anytime you're off the floor, you know, everybody's got a story of a relative that has fallen off a ladder at home from one time or another doing something. And I realize that maybe with the curtains, they're not getting that far off the floor, but there has to be documented injuries here too.
Oh gosh. Yeah, no, that's a major issue, frankly, Justin. And I don't know, some IDNs, like for instance, Kaiser Permanente, are currently disallowing staff to get on ladders. So that's a whole different scenario and potentially one that actually drives really what we're calling these no ladder solutions, right? Where people do not have to get on ladders, where they simply can just walk up to a curtain and exchange it. And especially, again, of course, looking at those isolation room exchanges there, or terminal cleans, if you will, where they typically are more prominent, I would say, than what we would call the periodic exchanges even, because that's where the protocol really supersedes that periodic protocol. Very, very important to get these people off ladders. Frequently, by the way, it's delegated to a floor or a trash tech. And they're the only staff that are allowed. And can you imagine in terms of the disruption to their job. They're there in the corridors maintaining floors, and then they get that call, that they need to go to a room that's undergoing terminal clean. They need to first take that curtain down, exit the room, go back to their task at hand, and then get the call that now the room is clean. And so the process again, that whole process just repeats itself. So no ladder is absolutely key here.
I think that gets amplified too when we're looking in the recovery room or we're looking in pre-op. And traffic never stops in these departments, and yet we need to have the curtains exchanged. But how can we exchange a curtain when we've got all this traffic coming through to our, past our pre-op bays, past our block room, or in our recovery room when we really don't want a lot of overstimulation, and yet we've got a ladder being banged open, people stomping up the ladder trying to change something. It just adds another level of difficulty, but also then just disruption and interruption. If you've got to sit there and get a ladder up at some point when a lot of our operating rooms, they don't stop. They're running 24/7. So how are you supposed to get people in there to do that when you need your recovery room and your pre-op all working all day long? So definitely I can see the ladders as just being very difficult, and a solution that doesn't require a ladder to be a lifesaver and a time saver for our departments.
So one of the things that we talked about also was sustainability at the very beginning, but we haven't dove into that very much. And I want to get into material composition for the purposes of one of the big areas that you address is having curtains that are 100% recyclable, and what that means, for the environment, and lots of green initiatives going on in healthcare today. But what are standard curtains made out of, and what happens when they're no longer, able to be used? Where do they go?
Yeah, so typically privacy curtains are made out of polyester. And so unfortunately, we're not seeing any recycling take place there. And of course, those curtains need to be laundered, as you can imagine. So with water usage, power usage, the transit, by the way, of the curtains being retrieved and then going off to the laundering facility and then coming back. We also witness very, very frequently the return of these reusable privacy curtains. And then, they're not even, I think we did a post on LinkedIn recently where the curtains came in a delivery van and they didn't even have plastic over them. So poor protocols surrounding how these, quote, clean curtains are coming back from laundering. I think Hank did a post on medical instruments surrounding that actually recently. Same thing with curtains. But when you talk about where people will think that this cloth curtain is going to last very, very long, unfortunately, with the wear and tear, almost 10% statistically of all curtains that go off to laundering in America never return. They either get lost or damaged or ragged out. Frequently, the mesh is torn, by the way, and that's kind of a driver because Joint Commission, for instance, does take a look at that visible damage or visible soil, if you will. So when you look at the rest of the world, they're increasingly embracing recyclable curtains. And the word recyclable, by the way, is really important because unfortunately, when you look at no ladder, let's say solutions in America currently, let's say a snap mesh solution. I don't know if you guys have noticed, but they're always metal snaps, for instance. Well, the moment that they're metal snaps, you can't recycle them anymore unless you're going to cut the metal snaps off of the curtain, obviously.
And who does that?
And no one. So it's one of those things, I think recently we did a blog post about where people during COVID, for instance, said, Eureka, we have found recyclable curtains, but then and now we don't need to launder, and this is really wonderful. And then the next question is, well, what material is that recyclable curtain made out of? And by the way, hooray, non-woven polypropylene, just like masks, gowns, bouffants, CSR drapes. But guess what? There we have another issue in our country. Namely, it's very difficult regionally to recycle number 5 blue wraps. So, again, we're excited, of course, to be offering a solution surrounding it, but it's just amazing how you think you solve for one thing and then another problem arises, right?
Well, it's interesting, like you said, about the metal snaps. And so, the material is recyclable, but logistically, it's just not feasible in practice. But you even talked about this other challenge, the curtains that you have at KleenEdge are recyclable, but without a recycling solution, it still isn't logistically feasible, right? So can you talk about how you're also changing the industry to make sure that recyclable material actually gets recycled?
Yeah, really good question. We were super lucky. So maybe about 5 years ago when we launched, and as you know, I come from Europe, so we do a lot of business surrounding cubicle curtains and what have you. But one of the things that early stages we would learn about was this issue surrounding number 5 blue wrap. So we partnered years ago with a company out of the UK that invented equipment that allows you to recycle not only the curtains, but any other number 5 blue wraps. So it makes it, the solution, if you will, is so much bigger than just our curtains, right? And our concerns surrounding curtains. But yeah, it's been very, very well received here in America. We started introducing it about, 6 months ago. But the solution, of course, has been around in Northern Europe for a long time. It's embraced widely at the NHS, so that should tell you something. But in Europe, the focus is 100% on recycling these non-woven number 5 blue wraps, right? It's so key because currently in our country, it's going into the landfill.
Well, you talked about where they're manufactured, and I think that's incredibly important because of that sustainability that kind of rounds us out here. The traditional association that people made about the impact on the environment, and we just talked about that with recyclable, but also where are they manufactured? Is it going to be easy to keep the right amount of volume coming in terms of supply? And so for supply chain, sustainability now means a number of different things, including if we change to a certain provider or a certain vendor or supplier for a product, how are we going to make sure that we don't run out and then have nothing? So can you talk just a little bit about that too?
Oh, gosh. Yeah, absolutely. And of course, the pandemic really highlighted that circumstance where, we couldn't get any containers out of Asia, where typically containers would be on the water for, let's say, 45 days. We were talking 5 months out. I'm sure we've all seen the headlines. So one of the things that were really important to us at KleenEdge was and it also speaks to our European roots, of course, but is to get that supply out of Europe where we could guarantee a 2 to 3 week turnaround instead of out of Asia, where it was, like I said, anywhere from 4 to 7 months and containers were unable to really get to our shores. Aided also, or another issue, of course, that we dealt with during the pandemic is that the cost of non-woven polypropylene went sky high. And so again, having that stability out of Europe was what really, really helped us for sure.
So interestingly, as we prepared for this interview and you and Melanie and I got together and kind of talked through some of the finer points, Melanie had the unfortunate experience to have to bring her son to the emergency room. And while she was there, this whole conversation just kind of came up for her in a really, I don't want to call it serendipitous because that almost sounds like a good thing. And, Melanie, I'm sorry you had to go there, but you really saw this firsthand.
So I did. And it was really, I hate to use the word funny because obviously I'm sitting in the emergency room with my son. He'd had a injury in jiu-jitsu and ended up with a fracture of his orbit and his nasal bone. It was a mess. But I'm sitting here in the ER and I'm waiting for the doc, and I'm looking actually at the privacy curtains in the emergency room. And Karen has been an expert for us on First Case and the Expert series. I've done all of her posts and I've read them all. And so like privacy curtains are like in the forefront of my brain, right? And I'm sitting here and the curtains actually looked pretty nice. I'm like, oh, they must have just replaced these. The curtains themselves looked pretty clean, looked pretty good. But I'm thinking of all the things Karen said about curtains, and I'm, looking at them, and it had the little tags on them where you could see when they had been replaced. Well, they weren't filled out. There was no information on there. And the netting on top of the curtains was all just grungy and tore up and didn't look clean. And I'm just sitting here thinking of all the things I've learned through the Expert series with Karen's insight and information. And as we talked about getting ready for this interview, I'm like, this is what I saw. And I never, I think, would have thought that much about a privacy curtain, even as a nurse who's been a nurse for 20 years. I don't think I ever gave that much thought to that curtain that I grabbed and shoved aside every time I took a patient into recovery or went into pre-op to grab a patient. Because I'll clean my hands first, then I touch the curtain, then I go get the patient. And that's probably not the right order to be doing things, but I definitely had an eye-opening experience in the ER. Even if it wasn't a good reason I was there, it put a lot of this information that we're talking about into reality for me, just seeing what was going on in the room.
Well, Karen, I think that really highlights this last piece I want to talk to you about, which is the software, because Melanie, like you said, you would never have known to even look at the tag. And here you are inspecting the tag like, when was the last time this was replaced? And wait a second, the mesh doesn't look like it's in great condition, and you're piecing it together. Karen, how do you make that operational? And we're going to use sustainable again, because if it's a manual process and a person is monitoring it, and then that person leaves, even the transfer of ownership over the process sometimes can get murky, or if somebody gets pulled in a zillion other directions. Like, how do you make sure that EVS leadership and frontline stay informed, know what to do, and can repeat that consistently?
Yeah, it's so interesting, Melanie, because to be honest, this is our finding also. Number one, either we walk into rooms where there's still a manual process, and guess what? It's way past our date. And when we say way past our date in America, that means, best we're seeing is a quarterly, biannual, or annual, but unfortunately we see them hanging for 16 months, right? Which is insane. The other thing that we're seeing all the time is that no one has bothered to fill them out, right? So date unknown. And when you go to the EVS office and you look in that 3-ring binder as we do, can you imagine? I mean, typically they have January, February, March, and then all the dates. And now add that complexity of, that terminal clean that we talked about, and 1,000-bed facility that we talked to the other day, literally are exchanging 40 rooms a day in isolation rooms. I mean, think about the numbers, right? And so the answer really is to get out of that archaic kind of system, if you will, and to use the software. And how does that work? It's so easy. I mean, you and I, look, we go to the grocery store, right? We're scanning, right? Everybody is scanning. So all it is, specifically in our software, what we use, we deploy NFC tags, and it works with an iOS or an Android phone. And it is literally like Apple Pay. You walk up to it, it goes beep, 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 and now you're done with a 3-second scan. And all the stakeholders get notification, supply chain, by the way, as well. Supply chain, infection prevention, EVS, the director. Even if you have 54 facilities, you will know exactly when, where, and what needs to be exchanged. And by the way, also so that you know that if you've got 100 currents to exchange on Friday, you probably should start on Tuesday already. But you also need to know, of course, that you have sufficient supply on hand, right? If we're going to exchange 100 currents, we need to know that we have 100 currents available so that we can do our job. So it all comes together. And then also what I talk a lot about is that articulation of isolation room exchange By the way, so that if I just exchanged a current due to ISO yesterday, and let's say the protocol exchange was coming up on Friday, that I now know that I don't need to go exchange that current again because we just did it, right? So what's cool about the software is that not only does it notify everybody in-house, but it also notifies the third-party service provider who might be an outside vendor who is coming in to exchange the current so that they know they're not going to have to duplicate exchange, right? But without it, how would you know? You don't.
I really like the communication piece because of something that Melanie brought up earlier. Like, there's a whole lot of traffic going on in surgical services and pre-op and post-op. And how do we fit in time to exchange the curtains without disrupting, the operating room and making sure that they're running? I mean, obviously revenue, it's the biggest revenue generator in the hospital. We don't want to disrupt that. We don't want case delays. Having those alerts would allow, leadership in the operating room to plan for it and maybe communicate. That is a bad day for you to come and exchange these curtains because we've already got a bunch of add-ons we weren't anticipating and it's a day ahead of time already. And so that would allow for proactive communication instead of disrupting everything. I also want to just tell everybody, this is what your customers have had to say. Daryl Hicks says, I have worked as an EVS director for over 34 years, and I know a thing or two about privacy curtains. Karen Goelst is the first person I've met who understands the struggles of EVS employees in providing a safe, clean, and disinfected patient care environment. The KleenEdge curtains project a crisp and clean first impression to a newly admitted patient and their loved ones. The KleenEdge proprietary software allows EVS leaders to efficiently track and document curtain exchanges. And actually, Daryl Hicks has been a guest on the Beyond Clean and Transmission Control podcasts in the past, talking about EVS and their involvement even in HCAHPS and patient satisfaction surveys. I've got another one here from Brian Varner. He said, KleenEdge reached out to me a couple of years ago to see if there might be a good partnership between us. At first glance, it seemed KleenEdge had a great product and technology, but I wanted to reach out to my healthcare experts and get their opinion. I shared information on the quality of the curtains, impressive technology to track curtains, and the significant cost savings on installation and service. All of my contacts were very impressed, with several considering KleenEdge as a primary curtain provider. Hospitals are in desperate need of saving money wherever they can, and when it comes to disposable curtains, I'm absolutely convinced KleenEdge is the answer. I proudly endorse KleenEdge and hope all healthcare facilities will consider them as their curtain provider. Karen, how can everybody sort of engage? If they haven't heard about KleenEdge or they haven't seen your product, you've got some promotions here. I think a free software and curtain trial, as well as a free cost savings analysis. Everybody's looking for cost savings these days. How would they proceed with that, and what does it entail?
Yeah, gosh, great question, Justin. I mean, really easy. Just reach out to me personally via email and we'll schedule a quick 20-minute Zoom call. In 15 minutes, we can pretty much go through the entire program, look at the various options, by the way, for no-ladder current solutions, because we have many, by the way, not just one or the other. And then from that, it's very, very easy to do a trial because all we do is we send in the tags, we set folks up on a demo, and off they go. It's so easy to use.
Yeah, and I think that cost savings analysis is really great too, that you're able to put together what the savings might be to really help people make a decision. Like, where does this go in our priority list? We've got to save $5 million this year. We're not going to do it in just one initiative. How do we place these initiatives into context? So to do some of that legwork and put that information in front of especially supply chain is really a great service that you provide. I do want to remind everybody they can find you on LinkedIn. They can connect with you there, but also if you're following the First Case podcast on LinkedIn or Facebook, you'll see Karen's expert series with an incredible amount of information on privacy curtains. You can go to the website, KleenEdge.com. That's KleenEdge.com. And then finally, you can email Karen directly. Her email is spelled KGOELST at KleenEdge.com. That'll be in the show notes and the write-up. And Karen, really great work. I love this focus on sustainability, really reducing the potential spread of infection and operational improvements that really can impact hospitals' bottom line directly, as well as patient safety and patient outcomes. Thanks for coming on.
Oh, thanks for having me, Justin. Melanie, great to see you again. And I will see you guys soon, I'm sure.
That was Karen Goelst, CEO and founder of KleenEdge. We're talking about privacy curtains, but building in automation, intelligence, tracking, taking a very sustainable approach, recyclable material that's also logistically feasible, and a process that is really designed to improve, patient care and outcomes and reduce infection prevention potential in facilities today. Melanie, you saw it firsthand. This has been an incredible challenge, and I have to commend Karen. She's been doing this for a while. This is her business. It's women owned, and it's got some really great messaging behind it too, and value, in terms of mission and values, not just value prop.
Yeah, it's just, I love her commitment to making it better, making healthcare better through something that a lot of us really overlook so often as healthcare providers. We roll into the PACU and we grab that curtain and we send it around and off we go. And we don't think about the contamination possibility with something as simple as a curtain. And yet she's committed her business and her life to making healthcare better. I mean, the story of her son really hits home with how this really affected her and his experience, and my own experience in the ER too, watching it in real life happen in front of me with everything I've learned from her. So I really think that there's a lot we can learn and a lot of ways we can improve just by managing our curtains better.
Well, she mentioned it, 50 to 85% reduction in acquisition costs, as well as 35 to 55% operational cost reduction. So you're getting it on the front end and throughout the life of using the KleenEdge curtains. I think one of the other things that we talked about that stood out was instead of 4 or 5 curtains that the EVS workers have to get up on the ladders to be able to hang, you're talking about 1 curtain per track, and nobody has to get on a ladder. I think that's another big takeaway. If you want to learn more, definitely follow the First Case podcast, because Karen is an expert on our expert series. You can also follow KleenEdge on LinkedIn. You can find their website, KleenEdge.com. That's KleenEdge.com. You can email Karen directly. I'm going to spell that out, KGOELST at KleenEdge.com. She's happy to schedule a 20-minute Zoom because they have a free software curtain trial and cost savings analysis offering to the listeners. So go ahead and reach out to her directly. That's going to do it for this vendor spotlight, but I do appreciate everybody listening today, and I'd appreciate it if you downloaded our smartphone app for iPhone and Android. We've got it for First Case. We've got it for Power Supply. We've got the app for transmission control. You can follow all of the brands on social media. Really would love feedback, like, subscribe, share this if you learned something in this episode today, or comment on the post. And finally, on behalf of Melanie and myself, thank you for listening to this vendor spotlight on First Case, Power Supply, and Transmission Control.